for aligned territory business managers in Texas, New Mexico, and Kansas, as well as working with a marketing liaison through Zoetis Beef Anti-Infective Team. Big word. His primary focuses are the prevention and control of bovine respiratory disease, the integrated health and performance management from ranch to feed yard finishing throughout the beef production chain. Dr. Pollreisz grew up on a small beef and horse farm in Illinois and received his DVM from the University of Illinois in 1985. His first position out of school was as a staff veterinarian in an integrated ranching, feedlot, and packing plant operation in western Nebraska. He also spent 6 months in a mixed animal practice in Fairbury, Nebraska, before joining the Palo Duro Veterinary Service in Canyon, Texas in 1986. While there, he served as a consultant veterinarian in backgrounding and feeding operations in Texas, Oklahoma, Kansas, Illinois, and Wisconsin. JP joined the Zoetis family in 1992. He is a member of the Academy of Veterinary Consultants and has previously served on the board of directors, as well as serving as the AVC's first appointee to the National Cattlemen's Beef Association. First 3 years of the BQA task force training starting in 1991. With that, turn it over to you.
Thank you. I appreciate that.
Turn this off.
Good afternoon. So I'm going to talk to you about basically building health and then ultimately value in the calves at the ranch or the backgrounding level as they go on into the next phase of production, typically into a stocker or feedlot operation is kind of where I'm going to focus upon. But seed stock is not immune from disease, and particularly bovine respiratory disease as well. So I think it is applicable. It's about bottom line. It's about profitability. Bovine respiratory disease, subsequent respiratory disease problems. That year, what it takes away from a calf crop, you can have the best genetics in the world, but they don't perform well in the dead pile of a feedlot. And too often I've seen incredible genetics, the power of that not realized because of health problems that ideally could have been addressed with more attentive and more aggressive health programs back at the ranch. Whether you're capturing premiums, the natural market to minimize or eliminate the use of antibiotics, that's a big focus from our beef consumers today. I don't know that they completely understand it all. We need to keep telling the message that regardless of whether a calf's been sick once and was treated with an antibiotic, if it's pulled early and treated with an effective antibiotic, those animals can go on and perform comparably to an animal that never got sick. And from a quality perspective, I'll eat a treated calf all day long. We produce the safest beef in the world. I want to emphasize that. I know I'm preaching to the choir, but this idea that no cattle should ever get sick and should never require antibiotics, now we're starting to get into welfare issues because cattle are going to get sick. They're not unlike human populations, and some of them are going to get sick. We try to minimize that, but that is an increasing concern. And the better the health program at the ranch level, at the backgrounding level, the less antibiotics, logically, that we're going to need to put in those animals. Cost of bovine respiratory disease, when I got out of veterinary school in 1985, we said it was 500 million. Now it's up to $1 billion. Throw inflation on top of that, but frankly, I think that we're dealing with tougher challenges today than we did in the 70s and in the 80s. We've got some different bugs. We've got some of the same bugs that have bigger teeth now as far as causing disease, and it's really a challenge. This is one of those falls as I talk to my practicing and consulting veterinary colleagues around the country, as I talk to ranchers, backgrounders, and feedlot operators. This has been a tough fall. People basically trying to do everything right, and yet calves getting sick. Some of those calves going on and becoming chronics or deads in a backgrounding or a feeding operation. And one of the tough things this year is these sunbucks won't get straight. We used to say, get them straight in 28, and that's a dream nowadays. I mean, we still have to be on top of them at 60 and 90 days. Still watching those cattle very, very close, and that's frustrating, it's perplexing, but I think there's still some fundamentals that we can implement at that ranch level to try to minimize those downstream problems, particularly with bovine respiratory disease. This is old data from Texas Ranch to Rail. Dr. John McNeil, God rest his soul, he's passed away, but was involved with this. Many states and extension agencies have replicated this. Basically, the variable here is how many times an animal was treated in their ranch to rail program versus the percent death loss and chronics versus from a 0 treat all the way out to treated 4 times, medicine costs, and then average daily gain. What's not on there is feed efficiency. Even if we can keep them alive, those animals logically don't perform as well. I have a friend, a veterinary consultant out of Hereford, Texas, that, you know, there's the rest of the story. Even a chronic, if we can keep them alive and feed them long enough, we can actually get a chronic calf to ultimately perform and grade choice at a packing plant. But if you look at the length of the time and the feed efficiency and the dollars it took to get there, that's a losing proposition. We don't want to see anything die, but from a profit perspective, just because you can get a chronic to eventually grade choice does not impact your bottom line well. Okay, so just basically a reflection in numbers of what respiratory disease costs and the subsequent number of treatments beyond how well the antibiotic worked in that first or second treatment slot. Vaccines have a lot to do with how many times a calf has to be treated and retreated as well. Clinical respiratory disease, we call it the respiratory disease complex. It's basically forever defined as a 3-step process. Stress, you know, certainly stressors, weather, weaning, all the things negative that certainly you as stockmen try to minimize the impact of. Nutritional stress is a big deal here as well. Micro and macronutrient deficiencies play a role here. In effect, it makes that animal more susceptible to infections that normally would not have gained a foothold and they'd have just walked right by it. Maybe had what we call a subclinical infection, showed no disease, no sickness, didn't need to be treated, knock it out and move on. When we have an animal that's compromised in their resistance because of stress and the types of stressors that I mentioned, they're then susceptible to the second stage of respiratory virus infections. Those viruses then make them susceptible to the end stage bacterial respiratory infections, which typically are the end stage killers or the ones that make them chronic. The key here, not so much that we need to focus today on each and every one of these, but the fact that this is a staged process, and the more effective we are in addressing resistance and prevention at each of those stages, instead of focusing on just one stage. You might you have a calf die at weaning time, have calf maybe on the cow. You send the lung in and you get Histophilus back, or you get Mannheimia back. Don't succumb to the temptation of saying, I need a Histophilus vaccine, or I need a Mannheimia vaccine. That may be a part of your solution, but to over-focus on just one component here, you're going to be sorely disappointed in your outcomes. We need to manage this in a very comprehensive, holistic way for the best outcomes and focus on all 3 stages of bovine respiratory disease. Let's talk a second about colostrum. Y'all know how critical it is. Y'all, I would guess, to the person, calf on pretty big country, it's not real easy for you to manage colostrum. If you have to pull a calf, that may be an opportunity, but to manage colostrum in a beef herd is far tougher than it is in a dairy operation, where the best dairies actually have supplemental colostrum on hand and make sure that every calf that's born is tubed with colostrum to assure adequate colostral uptake. If only we could achieve that in the beef industry, frankly, that would minimize some of the health problems that we have. It really would. We can't do that. The point I want to make about colostrum is its importance not just in scours prevention, but also in setting the stage for the calf's disease resistance and immune responses for the rest of their life. This has been well documented with tons of research at multiple universities for decades now, is there are hormones in there. There are signals between cells, not just the antibodies that those calves receive from mama to resist that first couple, 3 weeks of scours challenge, but setting the stage of the immune system, frankly, good or bad, as to how that calf is going to respond to vaccines and resist disease for the rest of their lives. Colostrum is really critical. There are some ways you can evaluate it. To manage it in a beef herd, there are some practical implementations that you can try to optimize the quality of colostrum within your beef herd. Be no surprise to you that nutrition is at the top of the list. You have your highest quality and quantity of colostrum with adequate nutrition, and I'm not going to go into great detail on that, but if you want to discuss it further, I'll leave you with my contact information. That's very critical. On a herd-wide basis, whether this fits your management chain or not is debatable, but on a herd-wide basis, looking at across your whole herd, your level of colostrum on the whole population is optimum. Your ratios of mature cows to heifers is also pretty critical. Heifers tend to have lower quantity and quality of colostrum. What does that matter on an individual basis? Because things like scours are a herd-wide disease. You start with a little spark of maybe one scouring calf, that gets into the environment, you get other calves that are exposed as they're born, and you go from a spark to a forest fire in a week to 2 to 3 weeks. And so looking at colostrum as a herd-wide phenomenon is something that we recommend you consider in trying to optimize that in your operation. There's a lot of stuff on that that's not within my time today, but I would encourage you to think about colostrum in your operation and not just accept the fact because you're in beef production, there's nothing you can do about colostrum and you just have to assume that those calves are getting adequate colostrum. The downside, there's a downside to colostrum. God didn't design it this way, but as we came in, however many years you want to accept that cattle have been on the earth, we came up with these neat things called vaccines. Typically, scours is more of an immediate challenge, and colostrum is very critical in preventing scours. As we get later into the respiratory disease challenge in these calves, arguably weeks to months after birth, colostrum becomes less critical. What we've actually found is some of the colostral antibodies to the respiratory viruses and bacteria can partially or completely block the responses to the vaccines that you use in good faith, spend good money for, and expect to get protection come pre-weaning and weaning and shipping and backgrounding and feed yard time. So that's a phenomenon that's been widely researched. The research, frankly, it's equivocal. There's some instances where we did not see blockage to injectable vaccines. There's some instances where we saw complete blockage, and we don't have that entirely figured out yet. But at the end of the day, we know that there is this phenomenon called maternal antibody blockage, particularly to injectable respiratory vaccines, that we really need to take into consideration when we're vaccinating these calves, especially early in life. Branding or turnout time is a real focus here. I have Kansas State and Texas A&M. Congratulations to the New Mexico State football team for going bowling the day after Christmas this year. Beat Bowling Green, I believe, is who they're playing. So go Aggies. There we go. Just a visual, that that Texas A&M punt getting blocked was not a good thing for the Texas A&M football team. Your respiratory vaccines getting blocked by good maternal antibody transfer, which I've just told you is so critical for the short and long-term health of your calf. We're dealing with a paradox here, okay? So how can we get around that maternal antibody blockage, especially on respiratory vaccines? There's a part of the immune system that colostrum has very little impact upon, particularly the antibodies that it transfers against the respiratory viruses and bacteria. We call it the mucosal associated lymphoid tissue. I paid $20 to learn that term, so by golly, you're going to hear it. Think about malt. Think about the nose, but it also is reproductive tract. It's eye for pink eye. But that mucosal associated lymphoid tissue is a whole different part of the immune system. If we can figure out how to stimulate that malt, we can overcome that maternal antibody blockage and actually stimulate immunity at the site of most respiratory infections before it even gets into the body. And now antibodies and injectable vaccine responses need to take over. You're going to see more and more about this immune system. The skin is also part of the mucosal associated lymphoid tissue. Y'all have heard about the triple demic right now, which is corona, flu, and human respiratory syncytial virus. Actually, HRSV is very similar to bovine respiratory syncytial virus, or BRSV. What they're finding is that if they look at the cattle model, there's a lot of promise for HRSV vaccines, human vaccines, that they've not been able to come up with yet. The paradigm in human vaccinology is killed vaccines. What they found with the killed HRSV vaccines is not only didn't they work, but it made the disease in many infants worse when they were vaccinated. Hence, we've got no HRSV vaccines on the market. There's 3 candidates that are on development, and optimistically hope at least one of the 3 is going to be launched next year. What a blessing that would be, because it's a bad, my son had it when he was young, and it's a bad deal. I mean, it kills infants. One just made the news. But at the end of the day, one of the 3 is an intranasal vaccine. It's exploiting this mucosal associated lymphoid tissue. They have learned that from veterinary medicine. As of recently, Zoetis does not have the only intranasal vaccine. I'm not making this a dog and pony show, but I'm going to use my experiences and the research I have behind the products I support to demonstrate a principle. Enforce 3 was launched about 11 years ago. It overcomes that maternal antibody blockage. It goes in the nose, either 2 cc's in one nostril or 1 in each nostril. It overcomes maternal antibody blockage. It gives you basically immediate protection. And the real key is by stimulating that malt, it primes those animals to respond more rapidly and to a stronger degree than if they had not seen a vaccine at all, or if they'd seen an injectable vaccine for the 3 viruses that are included in this product. Okay, so the key here is stimulating that mucosal associated lymphoid tissue, and it really is ideally the first for those 3 viruses, IBR, PI3, and BRSV, is the first viral vaccine that a calf or even a yearling sees if they've never seen a vaccine or been exposed before. That first exposure sets the stage for subsequent responses and disease resistance for the rest of their life. Many of y'all participate in Back 45, some kind of spec type programs. And you've heard that to qualify in this program, they need a Pastorella. Pastorella actually today, we call Mannheimia hemolytica. We used to call it Pastorella hemolytica. that's confusing because there is another Pasturella species called Multocida. There are other bacterial infections like Mycoplasma bovis and Histophilus somni. But this is really this Mannheimia hemolytica, what we used to call Pasturella hemolytica, is the bad dude on the block. It's the one that causes lesions like this. To orient you, this would be the lung of a calf. His head would be right here. His tail would be back here, looking at the lung. That right there, and arguably that's not even normal, but this is what this calf was left trying to oxygenate with, trying to provide his body. And this is not uncommon on the BRD necropsies that we see in, whether it's put together calves or ranch calves that die of BRD. This is not an uncommon finding. Okay, the wonder is that this calf lived this long. It's amazing that this calf lived this long. But this is a Mannheimia hemolytica type lung. This is the one that we have the best vaccines for. It's been acknowledged through the years to be the most important of all of the bacteria that calves can be exposed to. Yeah, there's exceptions. But at the end of the day, if we can get good Mannheimia protection, we're going to have a better and an optimal respiratory disease vaccination program. Okay? The vaccines we know in this particular bug, if you will, or bacteria, we know what we need to design into that vaccine because of all the money and focus in the research on it for many, many years. We don't have that, unfortunately, with the other respiratory bacteria. So you see, there are several Mannheimia vaccines on the market. I've already talked about branding time and setting them up for a pre-weaning or a weaning time immune response. The technical or immunological term for that is called prime and boost. It makes sense to me, whether my analogies make sense to y'all or not. I apologize if they don't. But if you ever watch boxing, right? The bombers that come in and all they have is an uppercut, or all they have is a big power punch, rarely have you ever seen them become world champions. The best boxers can box as well as hit. And in a boxing, most of the time you're going to see a jab to set up the opponent and then a roundhouse or an uppercut to take them out. Prime boost is like that. The prime is the jab to set them up for the uppercut that's coming later on. The jab at branding time, ideally for those three viruses, is an intranasal exposure, which sets them up better for the injectable vaccine response that they're going to see at pre-weaning or weaning time in a well-managed program. This is what we're learning. The change in paradigm here is that historically we've given the same respiratory vaccine, the same brand, the same combo at all these phases of production. We give it to the calf at branding time, and we come back with the same vaccine. Might still have some left in your refrigerator. Give it to the calf at weaning time. And if you retain ownership, you may give another dose of the same vaccine as those calves go into a backgrounding operation or stocker or ultimately into the feedlot. What we're learning is these different presentations, especially that mucosal presentation first, followed by a $10 word called parenteral, which means injectable, by the parenteral presentation second. That is optimal to get the most effective immune responses. So this is just an example of managing all the way through. These are some of our products. I'm not going to overly focus on that. We at branding or turnout, looking at the intranasal vaccine, the Mannheimia and the BVD. The best vaccines at this point are still injectable. There are considerations of maternal antibody interference, but we find that a modified live BVD vaccine does not behave well in the nose and can actually set cattle up to be sick. And so we don't have a modified live intranasal at this point. So this is what the complementary product that we have. Clostridial vaccine would be any of these brands. Histophilus, you don't want to throw the kitchen sink. If you have documented Histophilus problems in your calf crop, in your cow herd, and or reported back to you, there's an opportunity to incorporate that into your branding and your weaning programs. But if you don't have evidence that it's there, don't just throw the kitchen sink at them. There's a downside to too many vaccines. And so this is one that's very, very need-based. I see a lot of one-dose Histophilus vaccines, and the only thing that one dose of a Histophilus vaccine is doing is making the owner comfortable that they gave it. But one dose of a Histophilus vaccine from a protection perspective is basically the same as 0 doses. And I see that, I see a lot in this state, so just be aware of that. Then you can follow up with your parenteral vaccines if they were primed at that branding time. Mama sets the stage. Veterinary practitioner out of Alliance, Nebraska, as I was getting out of veterinary school, really made this point to me, and it stuck with me for my veterinary career. Said, JP, if you're having problems in calves or in ranch calves, we tend to say, okay, what did they get at weaning time? What did they get? Wow, we'll go all the way back to branding time. We need to be going back to mama. Mama provides that colostrum. Mama can also provide the disease exposure and challenge that those calves see even while they're still nursing. And mama's protection, whether she's vaccinated or not, and what she's vaccinated with, is not just for improved reproductive outcomes and percent calves that hit the ground, but even the percent calves weaned now and how those calves go on and perform. Focus on mama cows and a good vaccination program. Talked about stress being the first step. Nutrition is so critical, and adequate micro and macro nutrition. Vitamin A, E, copper, selenium, zinc, protein and energy. So critical from a health outcome perspective. But focusing on the mama when you're having problems with the calves is really a productive step, and many times an opportunity for improvement. I'm going to finish with this. This isn't, say, well, that's not respiratory disease. Everybody looks at this. I mean, you're going to say, okay, coccidiosis. What's the big deal about coccidiosis? I never see a bloody. That's the rats under the cellar. If you are raising calves, you have some degree of coccidiosis infection. Long before you see bloodies, subclinical coccidiosis infection brings down the resistance in your calves as well as their response to vaccines, and even ultimately of the ones that get sick, the treatment response you get out of antibiotics. So some kind of a coccidiosis control program. If you're feeding mineral, some Monensin or Bovatec will help control it. There's different ways to address that on pasture, especially if you're weaning your calves at your place or they're going on somewhere else. But a good question to ask, what's your coccidiosis control program? Because it's way beyond whether you see bloody scours or not. It actually is more impactful by the amount of respiratory disease that you see as well as the treatment response of the ones that get sick, because it suppresses that immune system. Remember the 3 stages? This would fit in that stress stage. So I am going to shut it off there to leave time for any questions. I had a lot of stuff to continue to go through, but I think less is better today. And I'm going to leave you with my contact information, and appreciate everything that y'all do for the cattle industry here in this state and across the country. I sincerely mean that. I hope this is of some value, but the key here's my contact information. Would love to work with you and your veterinarian, your nutritionist. If you're having trouble, that's where I as a Zoetis employee and us as a company, as well as our other colleagues for other companies, it's easy to be quote unquote your partner when times are good, but when times are bad, that's where the rubber meets the road, and I want you to exploit the resources that what we call the allied health industries, the drug companies, have to offer. So keep that in mind. Yes, sir.
How do you adjust, if at all, your vaccination protocol with drought?
How do you adjust, if at all, your vaccination protocol with drought? I would say that specifically as relates to which vaccines and when, there's not a lot of adjustment. There's really no adjustments that I would offer. I think the key there is, what are you doing differently from a management perspective, and does that change when and how often you're handling your cattle? Look at every time that you're handling your cattle as an opportunity for a health intervention. I'm not talking kitchen sink and to over-vaccinate or just to do it because they're through the chute one more time, but a good discussion and a focus on reproductive and respiratory disease and where those cows and their calves are at in their life cycle and where their immune system is at. I'm going to exploit the opportunities as a veterinarian in working with you as a rancher as to when do you typically handle your cattle? Has that changed in a drought situation? That's really the best answer that I can give you, I think. And tongue in cheek, but in all reality, also have realistic expectations. I think a big part of this being one of those years is we've had a nationwide drought. There's been pockets, obviously, that had some pretty good rain and grass, but nationwide, we have a compromised calf crop that's coming in, whether they're weaned early, people fed, whatever. But nutritionally, we have a compromised calf crop, and I have to have more realistic expectations of the amount of disease, even with the best vaccination programs, that I'm going to see. I'm not using that to pass the buck. Where the rubber meets the road, so many people are trying to capture the natural market. I have two suggestions on that. Take them for what it's worth. It's worth every bit I'm charging you today, right? Old Doc's good. He's worth every bit he charges. Two things about natural. Number one, if you want to capture it and you're going to forego conventional technology like implants, be sure you have that market captured. If you're just taking a chance you can get it and you don't get it, as an example, if you're not implanting your calves at branding time, you're leaving 20 pounds on the table when you wean those calves. Yeah, that takes them out of qualification for the natural market, but if you don't have that captured, that's a pretty big gamble. In the natural market, in a feed yard or a backgrounding operation, I consistently see this year after year, where people will want to capture it. They've got a pen of cattle. Might be your ranch calves. Those calves start getting sick. They tell the pen riders, you might have pulled them today, but every calf you pull and give an antibiotic to, you lose $200. Yeah, that's a big deal. But if you're pulling calves late and you ultimately have a pen-wide outbreak that needs to be managed with what we call metaphylaxis and everything needs an antibiotic, I invariably see people wait too long. They end up with over 60 to 70%, sometimes 90% of those calves still having to be treated with antibiotics, but they're a day, if not a week short, and end up, I see 10% death losses in those type of cattle. So knowing when to pull the plug and giving up that natural for the overall end stage is a critical thing too. So I hope that answered your question, but it also gave me an opportunity to talk about this natural thing as well. I'm not against it, but don't let it cost you money on the chance that you might get a premium.
You have any other questions?
Thank you.
Appreciate y'all.